Hi everyone, Dr. Carri, physical therapist here, and I want to talk a little bit more about long COVID and pelvic pain. Since I started talking about this, I have more and more responses to this, so I'm assuming it's much more common than anyone's talking about. But I want to tell you there is help and there is treatment. So the most common thing I've seen with my long COVID patients and pelvic pain is more like, it's more tailbone pain and rectal pain. So I'm going to show you my pelvic model. So here's the pelvis, here's the backside. And so it's a lot of pain in the tailbone, in the rectum. And if we look at these muscles, they surround the rectum. This is a female model. They also surround the vagina. And so I think people think about pelvic pain being like pain with sex or something else. But I think with a lot of my long COVID patients, I think a lot of them had digestion issues with their infection and maybe a lot of diarrhea, upset stomach, and maybe constipation, but most of them I've heard it's like upset stomach, diarrhea. Like we know there's some GI disruptions that can happen with a COVID infection. That's like a known symptom from the beginning. And so I think my patients that I'm seeing are having that. They're having a lot of GI symptoms. And so it's a lot of disruption to this area, right? If you're going to the bathroom a lot, these muscles get irritated. So that's why often their pelvic pain is around the rectum or the tailbone, which is also connected into these pelvic floor muscles. So there is treatment for it. I will link another video I did about pelvic pain and cycling. And often it's the same muscles. So I'm going to show you the bottom of the pelvic muscles again. So this is the backside. Here's the bottom. So all these muscles, we sit on this, right? We sit all day. And so I did a video on pelvic pain with sitting or with cycling. And so a lot of those exercises would be appropriate for my long COVID pelvic pain patients. And so what that is a lot of stretching, a lot of mobility, and yeah. So I also created a longer, more in-depth course on my Teachable site that I will also link with having to do with tailbone pain, having to do with tailbone pain and treating that. And so in the clinic, if patients come to see me in person, I do a lot of work on the glutes, which are like thicker outside of here. These are the underneath layers. I do a lot of massage work and manipulation, I guess you would call it, around the tailbone and a lot of these muscle connections in here. And then for my patients that are really having rectal pain, internal pain, we'll work internally in the rectum to release these muscles. So we can work on them outside, but if it's really rectal pain, I'll work inside. But if it's more tailbone pain, I'll work outside, the really small attachment muscles here, and then the bigger glute muscles on the outside. And so I do a lot of that in the clinic. In my online course, I teach people how to use a tennis ball and like self-massage these muscles from the outside. To get some relief, and then all the exercises that I teach in the clinic. So again, I'll link my YouTube video that has pain with sitting or cycling, which is the same muscles as my long COVID pelvic pain patients that you can check out, try some of those. And then also I have like a more in-depth on Teachable, a course on tailbone pain, which would apply also to my long COVID patients. So hope that helps. I really want to give you guys hope that there is help. I would say my long COVID pelvic pain patients have all gotten better. Some of them I've seen at various times past their infection. Some people I saw 2 years later because they got it when COVID was brand new. Some people got it this year and I saw them within a few months. So it really varies, but I would say they all got better. So find a pelvic floor therapist near you. I can also link my blog that has resources to find a pelvic floor therapist near you. So there is hope. Get help. I know it's a long, frustrating road. We don't have a lot of information, but this is one thing I would say I really see success with. Okay, thank you. Don't forget to like and subscribe.